A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
During the pandemic, the need for mental health services continues to increase. According to the Kaiser Family Foundation, 4 in 10 adults in the U.S. report symptoms of anxiety or depressive disorder, up from 1 in 10 adults prior to the pandemic. The pandemic has also caused many of us to reevaluate our priorities. More than 4.3 million people have left their jobs in August without any plans to return. That's over 20 million since April, as people say they no longer want to feel stressed, underpaid, and unfulfilled. But there are opportunities where you can make a difference at an organization where everyone feels respected, valued, and empowered to become their best selves. Find out more on this edition of your Hometown Health Connection. I am Kate Glazer. Welcome to the program. BestSelf Behavioral Health is the largest community-based behavioral health organization serving children and adults of all ages in Western New York with education and vocational support, mobile mental health and substance use disorder services, homeless outreach, housing, community, and school-based programs. BestSelf's Child Advocacy Center protects children who have suffered from significant and often unimaginable trauma with 15 locations in our hometown.
We at BestSelf have a vision
where everyone is empowered to be their best self.
BestSelf values equity.
BestSelf values diversity.
BestSelf values inclusion.
We value a culturally diverse workforce.
We make us stronger together
and improve our services.
We strive to be family focused for all kinds of families.
Whether it is the one you were born with or the one you chose.
We strive to ensure that our services are equitable
and focused on reducing racial and ethnic health disparities in people's lives.
We strive to ensure that our services are accessible.
In your own language.
In your own community.
We strive to ensure that all of our services are culturally considered.
And evidence-based.
We strive for diverse community collaboration and partnerships.
We value developing diverse leadership at all levels of the organization.
Come join the BestSelf team.
Vous êtes la bienvenue à BestSelf.
Ven, únete a nuestro equipo aquí en BestSelf.
Chúng tôi ở BestSelf Behavioral Health xin mời cộng đồng đến với công ty và tham gia ở đây.
فرمون باش داربن لقل BestSelf.
انضموا إلى فريق BestSelf.
Today we are here not just to talk about BestSelf behavioral health services, but also how you can become part of the BestSelf family with opportunities to have a meaningful work experience and making a difference in people's lives. BestSelf behavioral health has positions that do not require extraordinary training and some that do. Hear about opportunities where you can actually get paid to receive training or work part-time with opportunities for advancement. Joining us are Liz Woike-Ganga, President and Chief Executive Officer. Liz received her undergraduate degree from Yale University and her master's degree in social work from UB, beginning at BestSelf as an intern. She currently oversees all of BestSelf's administrative departments. When she is not working, she enjoys yoga, hiking, reading, traveling, and hanging out with her children. DeWan Stroud is Chief People Officer. DeWan has a BS in business with a specialization in human resources from Damon College and currently oversees human resources, recruiting, employee engagement, and employee wellness at BestSelf. DeWan enjoys helping people develop and achieve their personal and professional goals, and when he is not working, he enjoys coaching youth sports and spending time with his family. His mantra is to be better today than you were yesterday. Welcome to the program. So good to have both of you guys. Thanks so much. DeWan, what was it like for you to become a part of the BestSelf family? It's pretty new for you, I've heard, so talk to us about what it's like to have become part of the family.
Yeah, it was a wonderful experience. I mean, every day I'm excited to come in and go to work, and I enjoy spending time with the team members and learning about them, learning about the agency and you know, the services that we provide to the community. It's really been a great experience.
What have you found here specifically that really draws you into the BestSelf family?
That we are committed to the mission. We are really about empowering people to be their best selves, empowering people in the community, empowering our employees. We want people to enjoy what they do every day, and that's exciting. That's exciting to be a part of.
What do you think people find different at Best Self that makes it much more than just a job?
I think it is just the mission, right? I think most jobs, most careers are about getting a task done, and we are about the getting better every day, right? This continuous improvement model that we are about for people, and I think that's different. It's not just about coming into work from 9 to 5 or from 8 to 4. It's about how can we be better today than we were, or be better today than we were yesterday, and next week than we were last week.
And the mission is so important, especially the values that it has a part of the mission. Talk about the values as well of Best Self and how that impacts the entire family.
Yeah, I mean, I think we look at it as beliefs, right? And so, for example, we believe engaged employees are essential. So we go into every day trying to figure out what we can do to keep our employees engaged. We communicate with our employees on a regular basis. We try to make sure we're utilizing their skills and their knowledge, and that they're utilizing those skills and knowledge on a daily basis, so that they can feel great coming to work, feeling as though we have a lot of people who put a lot of time into being great themselves, and so feeling that they can put that to use is something that we think is important for them to be successful and for us to be successful.
That's wonderful to hear. Liz, these days everyone is under stress. The demand to fill open positions is very high. People are stretched to their limit. How accommodating are you guys to your own staff?
Yeah, so we really value at Best Self being flexible and person-centered, both with the folks that we serve in the community and also with our staff. So to that end, we have all kinds of roles that have different work hours. So for example, your traditional 9 to 5 or 8 to 4, which is very convenient for certain professional roles, especially, for example, nurses who might be used to working those 12-hour or overnight shifts. We don't require that for the majority of our positions. But we also do have programs that are open 24/7, residential programs. We have a walk-in clinic that's open 24 hours a day, 7 days a week. So if folks are looking to work those kind of non-traditional hours, evenings or weekends, or maybe they want to work 4 longer days in one of our clinics and then have an extra day off with their family during the week, or for childcare purposes, we're really flexible with folks. We also have implemented a lot of remote work opportunities for those job roles where that's allowed, and we do have a mechanism where people can work part or even all of their week from home if their job allows.
For those tuning in, talk about the positions that you guys have over at Best Self and how someone might be able to fit into this amazing organization.
Yeah, well, we really have a number of roles open right now. We have seen a little bit of turnover, as many folks in our sector have, but we've also grown because there's a great need for our services in the community right now. So we've added positions, and we've also received a number of grant opportunities to expand our services, since there is a need and there's a lot of money coming into our system right now to expand services. So we have roles at all levels of the agency. We have roles, for example, in maintenance and janitorial. We have clerical roles at the front desk or behind the scenes, data type roles. We also have care coordination roles, which are maybe for folks who don't have a master's degree in a clinical area but still want to be working with people directly and helping them one-on-one. And then of course we have those roles that are more traditional behavioral health counselor roles, nurses, psychiatric nurse practitioners, doctors, etc. And then we also have a number of roles for folks who are in recovery from mental health or substance use disorders themselves. So those are, we refer to those roles as peer roles. We have a number of opportunities for folks who want to give back if they've maybe struggled with mental health or substance use issues and want to get a certification where they can give back and help folks get into and stay in treatment.
That's so inspiring. Talk about how that really helps someone coming into the program knowing that someone else was actually in their shoes.
Yeah, absolutely. It's really a game changer for some of the people that we serve in the community, some of the folks who maybe are a little bit skeptical about coming into treatment or are not sure what that's like or if that might be helpful for them, or maybe they've tried and failed before in treatment. At Best Self, we never give up on folks. Whenever people are ready to try again in treatment, we're there for them. And a lot of times for people like that, having someone to talk with who has been or walked in their shoes or kind of had a similar history to them is really powerful and could really help them take that first step, even if they have to work with that peer for a few weeks or a few months before they're really ready to talk to a counselor or a doctor. That's really the role that peers can play.
And DeWan hit the nail on the head when he said it's all about community and values and the mission. Talk about why people are so attracted to that and how you really have a community of people, not just workers, for BestSelf.
Yeah, I think we've really created and maintained a very nice culture at BestSelf, where people really care about each other, care about their coworkers, certainly care about making a difference for their clients in terms of empowering everyone to be their best selves. We have a very strong commitment to diversity, equity, inclusion, and belonging, racial equity as well. So we've really put a lot of work into making sure that everyone feels welcomed and like they're part of the BestSelf team.
Wonderful. DeWan, Liz had talked about the open positions you currently have, but let's reiterate some of those. So talk about from the entry level to the more substantial opportunities there. Talk about what people can be looking for when they come into BestSelf.
Sure. So I think, when you think about BestSelf and what we do as an organization, a lot of people feel that they have to have certain credentials to work in some of those positions. And that is true about some of those positions. But when you think about our customer service representative positions, it's more of an entry-level clerical role where you're not required to have a bachelor's degree in counseling or anything like that. It's more someone who can provide support to office managers and some of the staff and some of the different programs. So that's an opportunity that I think is open for someone with who may not have the education or the credentials that you're typically someone would have coming into BestSelf in one of those counseling or other roles. And then I think there's you look at, Liz mentioned the peer specialist role, someone who has lived experience, right? And that's really important to us as an organization, to make sure that we have folks who have lived those experiences and can bring those lessons and has credibility, right? And that can bring those lessons and opportunities for people to work with us and help in the community. We also have maintenance staff, so janitorial options where, obviously we have, buildings that we have to upkeep, and so we need people to help us with that. And so those are opportunities that I think people can look at and as a way to get into the organization.
A lot of opportunities for those watching, which is amazing to hear. Liz, what are the needs that BestSelf has for those with more training in counseling? Talk a little bit about that as well.
Yeah, let me first talk about kind of maybe more of a bachelor's level position for someone who's maybe not sure if they want to go into being a role of a counselor, but they know that they like to work with people and really want to make a difference. So that would be a kind of a care coordinator or case manager type position where you work directly with people and help them link up to the services that they need in the community. And that can often be an entree then into our more traditional master's level or even some counseling positions that don't require a master's but require a certification and a little bit of a little bit more education and some clinical hours. So then we can offer that right within BestSelf, kind of along a continuum. So that would be your traditional master's in social work or master's in mental health counseling. We have a tuition reimbursement program to help folks who maybe are in some of those clerical or case management roles and want to go back to school. So we'll help with support those folks in doing that, and in return for giving us a few years post-graduation. And then of course we have nursing roles. We do some nursing in our clinics, and it's more of a behavioral health type nursing, so there's not a lot of lifting or blood or those sorts of things. So sometimes it can be a good opportunity that's a little bit less stressful than working in a hospital type setting. And then we've had nurses go on to become nurse practitioners, so they can provide medication and support to our clients, all the way up through psychiatrists and medical doctors who help us with those clients who need medication to be stable.
Wonderful. You're so passionate about BestSelf. I can just hear it and see it. Right. Why do you love working for BestSelf?
Well, you know, I've been at BestSelf for many, many years. I was actually a student intern in the Masters of Social Work program at UB way back in the day, and I was hired on there. And I feel like I've grown with BestSelf, and I've been in a number of different roles, including counselor and program director. So, you know, I really see how we can make a difference in people's lives, and it's really everyone who touches our clients. So it can be that customer service rep at the front window, it can be the person answering the phone. There's so many opportunities to really make a difference in people's lives at BestSelf.
So much information, so many details. We will return to continue the conversation right after we tell you how you can connect with our guests. If you want to join the BestSelf Behavioral Health team or have questions about their services, you can find out everything you need to know at bestselfwny.org. This is a comprehensive website that outlines the services provided with video and, of course, information on jobs and positions available. The phone number to call anytime is 716-884-0888. Write down this information for yourself or someone you know who may need help from BestSelf or would be a perfect fit for this organization. We will be right back.
We at BestSelf have a vision.
A vision where everyone is empowered to be their best self.
BestSelf values equity.
BestSelf values inclusion.
We value developing diverse leadership at all levels of the organization.
BestSelf provides flexibility,
Generous paid time off,
And excellent benefits.
We have openings at all levels of the organization with sign-on bonuses for all positions.
Come join the BestSelf team.
Why do you love working at BestSelf?
And so it's a blessing to be able to be at an agency that allows you to grow with them, not grow the agency. So one of my experience with BestSelf is that it wasn't about me being able to just help the agency grow. It helped me grow as a person. And so being a vice president today really speaks to BestSelf, the culture. It really speaks to the investment they have in individuals, because they absolutely invested in educational and training and things like that for me to be able to actually have an experience where I am most celebrated, where I am most valued. And I really appreciate that with BestSelf. I think if you come and work for BestSelf, you'll find that they have a training track that will allow you to know many things if you just take the opportunity to spend and learn and, you know, take the suggestions. You too can be more than what you thought you can be. I know my experience is I am a completely different person because I work at BestSelf and they believe in me, not just professionally, but personally. They care about the character, they care about who I am as a being, and I bring that to work every single day because of them.
Welcome back to your Hometown Health Connection. I am Kate Glazer. We are continuing our conversation about BestSelf Behavior Health with Liz Woike-Ganga and DeWan Stroud on their services and opportunities. DeWan, can you talk about benefits available to people who work at BestSelf, such as paid time off, retirement plan, health insurance, training? Talk more about what you offer there.
Sure. So we have a comprehensive benefits package that includes affordable healthcare options. And I think the key there is options. We have a very diverse workforce. And so we know giving them choice to what kind of health insurance, dental and vision insurance that we offer, or that they can leverage while working for BestSelf is very important. And so we want to make sure those options are affordable. And then, you know, you mentioned our generous PTO program. It's a combination of our holiday, vacation, sick, leave, and it's important that we do that because we want to make sure that we give our employees some balance in their lives, right? And so work-life balance is very important. Liz talked a little bit earlier about the flexibility, so it's really important that we have that generous PTO. We also have a very nice profit-sharing 401k plan, and so, you know, we encourage our employees to utilize that opportunity, as well as some great employer-provided benefits such as life insurance, accident insurance, and things like that. So we do feel we have a very comprehensive benefits package that our employees really appreciate.
And there's also prorated benefits for part-time employees, correct?
Right, exactly. So if employees are not working full-time, we still offer benefits, and they're just at a prorated, in a prorated manner, but that's a lot more than other employers would offer. And so we really take pride in that, and we promote that to our part-time employees. So there's a lot of part-time opportunities as well.
Wonderful to hear. Liz, with such an important mission of helping so many people throughout Western New York, can you tell us how and why every position is important in terms of making it all work?
Yeah, absolutely. As we were discussing earlier, our clients come in to BestSelf really, usually in a great deal of distress for whatever reason whatever's happening with their mental health, or maybe they're having a substance use disorder problem, or they have a legal issue that's come up, and they need to be welcomed in and embraced wholeheartedly. So that's why everyone at every level of the organization is important in terms of engaging the folks that we serve. During the pandemic, as I'm sure we've all experienced, we're all going through an unbelievable amount of stress, and a lot of issues are going on with kids in the home and in school, as well as with folks who already have mental illnesses experiencing an exacerbation, and new people coming into the system who are maybe having issues that they didn't have before, as a result of the pandemic, or losing their job, or whatever it is that's going on. So we really want to make sure that we can be accessible for folks. So we have same-day access every day. We have telehealth available. We also have mobile teams who can go out to folks in their homes in the community if there's maybe a mobility issue, for example. So we really try to be flexible to our clients, and all of our staff have a role in that.
Wonderful. And why no one person is more important than another? Talk about that as well as sort of a motto as part of BestSelf.
Yeah, we really believe in empowering everyone to be their best self, that everyone at BestSelf is a leader, whether they're a leader in, as a clerical person, welcoming people into the clinic and helping the counselors get their work done in an efficient manner, or whether it's someone who wants to progress to a leadership or to a vice president, level even. We want to provide our staff with the tools to do their job really well, and then also to advance within the organization if they choose to.
And before I met you two today, it was so great to meet you guys. I would not think about children and how mental health and mental illness impact children in the home. So that is amazing to hear how you guys are really coming in, especially during the pandemic, like you had brought up. So talk about that as well for those listening who may, think more so about that and why that's so important.
Yeah, absolutely. Children and families have been under an enormous amount of stress. We know that our kids haven't been regularly in school or doing their regular social activities, so we're seeing a lot of children and families coming into the system for assistance, and luckily we've been able to help them, for example, by using telehealth visits that can be very effective, with teenagers in the home who are used to that, or if parents have transportation issues or can't be getting out and about. So we can really leverage that telehealth as well. So we really try, and we're also co-located in pediatric offices and in the schools, Buffalo Public Schools especially. So really trying to engage people wherever they are and whatever they need.
Wonderful. DeWan, can we talk about room for advancement at BestSelf? I know that's very important to people.
Yeah, so there are so many growth opportunities at BestSelf. I think if you look at the composition of the leadership team, most of those folks started as an intern or at the ground level and the frontline level at BestSelf, and worked their way through the agency. So there's tons of room for growth in different programs and administration. So there's great opportunity.
And you've been here only a short time, but you've seen so much with different employees that you've been engaged with. Just talk about the overall feeling of coming into work every day and having people advance like Liz has done with her career, and just seeing other people and talking to other people that have advanced.
Sure, it's a testament to the culture that was set at BestSelf, a culture of growth, development, empowerment. And so, people come into work every day knowing that their supervisors, their leaders are trying to do the best they can to help people grow, and they want to see everyone be successful. Part of that is knowing that if your staff are successful, that means your clients are successful, your clients are reaching their goals. But the other part of that, I think the main part of that, is you just want to see people be their best.
Wonderful. Liz, you've been there much longer than DeWan. So talk about the atmosphere. We have here that, staff just chills out. They hang out together. There's holiday parties. There's some fun engagement. Talk about the importance of that as well and how that really impacts employees that work at BestSelf.
Yeah, we really want to cultivate, an atmosphere where people can just get to know one another and bond and have fun, but also come to one another for support. DeWan and I were just in a meeting this morning, and DeWan remarked to me just how it seemed like the program directors, there were about 70 folks there, our middle management staff, how they just really enjoyed that meeting and being together and being able to touch base and see one another and talk and have breakfast together, etc. So we're really proud that our staff is really bonded and go to one another for support. We really encourage, one program director to seek ideas and support from another. We have an internal team that is mobilized, for example, if there's a loss of a client at a location, and so that trauma-informed care team will go out and give support to that team. So we really try to encourage that kind of support, and also fun team building activities. So over the summer we provided funds for each program, each team, to do something, out in the community, like a get-together or a boat ride or, a meal at their site, just so that they could do something on work time that was still fun. And hopefully we'll be able to get back to some of our other things like holiday parties and, summer gatherings, etc., as COVID stabilizes.
That's wonderful. Being at the top and seeing this employee engagement and just knowing that there's really some friendships that are a part of your employees, how does that make you feel?
Yeah, I was looking out at those leaders today and just thinking, these are really great people. They really are committed to the folks that we serve and also to each other, and then certainly to BestSelf as an agency. So yeah, it really makes me proud and pleased that we've been able to together create that kind of atmosphere at BestSelf.
Is there anything else you want to address today or get out about BestSelf and how it really impacts the community and Western New Yorkers as a whole?
Yeah, BestSelf is a really special place for our clients, special place for our staff. So we would love for people to, take a look. We have panel interviews every week. We have lots of opportunities for people to quickly get an interview and find out more about the kinds of positions that we have open at BestSelf and get people on board just as quickly as possible. So, please go to our website and check us out. Come to one of the open panel interviews and learn more about BestSelf.
And DeWan, let's just hit it home. You talked a lot about just different opportunities here. Why should someone apply for BestSelf and join your team and work with both of you?
It'll be the best decision they ever made. No, I'll say that, you really don't know the impact that you have on people when you are you're interested in seeing them be successful. And so I think when I look at BestSelf and what we do, it really is just about seeing people grow, seeing people reach their goals. And so I think that's better than almost any other job or career someone could be interested in. And so if you're really looking for something like that, then I think BestSelf is the organization that you would want to come work for. So.
Well, thank you both for being here on the program. BestSelf Behavior Health needs you. Now is the time to perhaps make a change in your life and join an organization where you can make a meaningful difference in the lives of others. You can find out everything you need to know at bestselfwny.org. This is a comprehensive website that outlines the services provided with videos and, of course, information on jobs and positions available. The phone number to call anytime is 716-884-0888. Write down this information for yourself or someone you know who may need help from BestSelf or would be a perfect fit for this organization. Thanks for watching. Be safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.